Nursing students, what would you do first? Your patient is coming in with severe right upper quadrant abdominal pain, nausea and vomiting, and her family reports her skin has become more yellow and she's been more confused lately. The night shift nurse tells you that Miss Sally has a past medical history of chronic alcohol abuse and her last drink was about 24 hours ago. You take a look at Miss Sally's labs and you notice that her liver enzymes and her ammonia levels are elevated, and she's a little hypotensive and tachycardic as well. So, which action should the nurse perform first? Give Zofran or lactulose, notify the provider, or initiate seizure precautions? What is the assessment data telling you? She probably has cirrhosis of the liver as evidenced by her elevated liver enzymes, right upper quadrant abdominal pain, and a past medical history of chronic alcohol abuse. She's also most likely experiencing hepatic encephalopathy as evidenced by her elevated ammonia levels and an increase in her confusion levels. Now that you have an idea of what's going on, Mrs. Sally, before answering a priority test question, be sure to always ask yourself 2 questions. Are your patient's ABCs stable or unstable, and is your patient safe? If your patient's ABCs are stable, then look for a possible safety issue in the test question. If your patient's ABCs are unstable, or if your patient is not safe, then your priority should be choosing an answer that helps stabilize their ABCs or make them safe. So, when choosing an intervention to stabilize your patient or make them more safe, be sure to ask yourself, is this an intervention that I can perform that can make this patient completely stable? Meaning, after I choose this intervention, can I go on to my next patient? Or is this an intervention that after I choose this intervention, I would still have to notify the provider for additional orders? So let me show you how this test taking tip works. In this test question, there's an evidence of an airway issue as well as a circulation issue. So this patient is considered unstable. So answers 1 and 2 are both correct, but after you do such, you will still have to notify the provider about a decline in her health status. And while initiating seizure precautions isn't wrong, when a patient is experiencing a decline in health status, you want to make sure you're performing an intervention that helps the patient's immediate issues and not future issues. So answer 3 is correct. You will want to notify the provider because notifying the provider prevents a further decline in this patient's status. Remember, guys, to only choose a nursing intervention in a priority test question, if it completely resolves the patient's issue. Follow me for more tips that teach you how to think like a nurse so you can choose the best answers on nursing exams, no matter how the test question is asked.